And with us is Ed Werheim, councilman from Smithtown. Ed, why the heart screening again, the free heart screening?
Well, this is our third year, Larry. Going forward, we've done this for the third year to support Heart Health Month. We had to actually have it a little bit later this year because of the inclement weather this winter. So we're working on it today. I want to thank Dr. Kavesteen once again for his service. We believe this is extremely important. It's offered to our employees in Smithtown as well as their families. I know it was well attended last year. I went through the screening myself. They do an excellent job. And of course, good health is important to both the employer, the family, and that's why we continue to do this.
Now, with the heart attack rate going up amongst women, wouldn't you recommend this for most women that are over 30?
Oh, I would highly recommend anybody who wanted to go through this screening. I think it's very thorough, and as we all know, there are many times when things are picked up in a screening like this that you normally wouldn't if you don't have an annual physical, which some people do not. So it's very advantageous that way to, if there is something wrong, they can discover it now. And Dr. Kavesteen, as he did last year, does an excellent job at the end of the screening. He sits down, he goes over the whole chart, and then if he needs to refer you to anything else for additional checkups, he will do that.
And with us is Bob Creighton, who's also a council person from the town of Smithtown. Bob, how important do you think these heart screenings are to people and to the employees?
I think they're very important, specifically for our employees, but for everybody in general. Preventive medicine is a wonderful thing. You should have some type of a physical examination every year, at least once a year. Things are found when the examinations are conducted that can stop future problems. So I think it's very important. I think it's particularly important for women who increasingly are subjected to more heart attacks than in the past, and their symptoms are entirely different than a man's symptoms. So preventive medicine or preventive opportunities like this serve the patients very well.
Now, with the high cost of health care and, having to get special tests done and everything like that, do you see this as a major advantage for the town, it being it's a free heart screening for the employees?
I certainly do. I think it's very important because, as you indicated, if you were to go to the doctor, it's very expensive. You should do it, but we are offering the opportunity for town employees and their families to come and take some of these tests that will cut down on their expenses. And if something is found, they can then proceed further and correct those problems.
And isn't it better that they find out here at the free screening than at 2 o'clock in the morning in an emergency room?
Absolutely. And as I say, symptoms, particularly for women, are different than they are for men. It's not always a pain in the chest. It could be what feels like a stomach ache or a pain in the jaw. Those things are very important. If that happens, you have to get medical treatment right away. But if you can find something here before there's a problem, that's very advantageous.
Now, this is the third annual screening. Are you for the fourth and fifth upcoming screenings?
Certainly, and I hope I'm here for them.
All right, Bob, thank you for your time.
Okay.
With us also is Town Clerk Vincent Pulio, who is with us from the town of Smithtown. And Vinny, you have a bit of a background as far as emergency work with the fire department and also with ambulatory. Now, from that point of view, how do you feel about free heart screenings for the Smithtown employees?
Well, I think it's a fantastic idea. Being a firefighter, ex-chief commissioner of the fire department, and also I ran on the ambulance for 30 years. Being screened for heart ailments, things like that don't show up, most of the time before it's too late. So this kind of screening helps to identify some problems that are, that might not be, readily seen.
Now, on your time as working in the ambulance for all that time, how many heart attacks did you see?
Oh, many, hundreds. Some cardiac arrests, but this helps to see, what the problems are and hopefully solve them before we get to that point.
Because a lot of these people that when you were in the ambulance didn't know what was going on with their body, didn't know it was a heart attack at time, or they suspected, or the ambulance drivers told them.
Heart attacks could show up in many ways, you know what I mean? And most of the time, it's pain along the arm, pain in the back, heaviness in the chest. So it's assumed by most people that, that they're having a heart attack. And it could sometimes it could last for hours, and then when it really gets bad, then they call us. Or other times, people are cautious, but not enough people are cautious.
Now, Vinny, this is your third time here at the heart screening. Will you be around for the next one next year on the 4th?
Yeah, I will. Certainly. In fact, I'm going to get screened right now, even though I do a yearly physical exam. This is just, if it's for free, why not get it done?
Smithtown. Lynn, how do you feel about these heart screenings? I know you've done work before in the Suffolk County as a Suffolk County legislator, but now we've brought it closer to home now that you're a council person in the town of Smithtown. Do you think these things are really good to have for the Smithtown employees?
Oh, I can't think of a better idea than having the employees come here free of charge and do a heart screening. I've already heard of 2 instances where 2 people were discovered that they might have had an issue and catch it right on time. I would say for everybody, go do heart screening. And what we're doing here in the town of Smithtown is proactive, and we're very lucky to be able to do this with Dr. Kavesteen.
Now, how do you feel about the news now that heart attack rates among women has quadrupled even in the past 3 to 4 years? How important is it for women to get screened early?
I would suggest women get screened as often as they can, not to forget their annual checkup. And I must tell you, as a woman, it does scare me. So besides getting screened, I know there are healthy ways of living, and that would include exercise and eating properly and not having too much fat in the diet. But I'm not the expert, and I think going to a doctor or going for a heart screening will teach a woman all of these things.
Now, Lynn, this is the 3rd annual heart screening for the town of Smithtown employees. You think there should be a 4th, a 5th, a 6th?
But I think it should be all the time, and I think it should be not just for the town of Smithtown. I think that every town here in Suffolk County, of course Nassau as well, but I'm speaking for Suffolk County. I think every town should be proactive, should get involved, and I think the county should also do the same thing.
Now, when we look at medical costs and how much, employee benefits are a huge part of the budget in the town of Smithtown. When we have free services like that, don't you believe that helps everybody?
Well, actually, of course it saves money, but I'll tell you what else it does. A lot of people, although we have medical insurance here in the town of Smithtown and we're very fortunate, I think what it also does is a lot of people neglect to dial that number and make the appointment. Here, they can come on their lunch hour, they don't have to make an appointment, run in, get screened, and it fits into the schedule.
Dr. Kavesteen, on behalf of the town council and town clerk Julio, I want to thank you once again for the service you provide. We're all very pleased to be here. We have this plaque for you.
Thank you very much. Of course I will.
Thank you very much.
Everyone needs yourself. Thank you. Thank you for all.
You're very welcome.
Giving us
Thank
this
you.
opportunity to help you there.
So, Dr. Kavesteen, how important do you think these heart screenings are to all these people?
Heart screen it's extremely important to for every community and all population. The reason for that is heart disease is easily can be detected and diagnosed and treated earlier on. Prevention and early detections are the hallmark of 2015 medicine. If you can decrease the risk factors and modify those risks, the risk of heart disease will go down, and it's a lot easier to prevent the heart disease rather than treat it. This is where the different approach in medicine come about. Rather than treating the disease and by giving medications and doing interventions when the disease is actually there, we can capture the patients and prevent them from having that disease, so they're never going to have the disease to begin with. It's similar to having an accident. If you know you're going to get to the car accident and you know you have to go slower, you're never going to get to the car accident, and that tragedy will never happen.
What are your chances if early detection detects that you have heart disease?
There are many risk factors for heart disease. Heart disease and strokes are very similar because of the fact is in heart attack the artery closes, and in stroke also the artery in the brain closes. They both happen with the same phenomenon called atherosclerotic disease and plaque rupture in the arteries. When the organ doesn't get the blood and oxygen that carries through by these arteries because it's clogged or closed, that part of the heart or that part of the brain dies, and as a result you have a heart attack and you have a stroke. Now there are many reasons that can cause this process. High blood pressure is number one. By decreasing the high blood pressure and reducing it by medication, lifestyle changes, and diet, that reduces the heart attack and a stroke by 20%. That's the easiest way. Stop smoking, that's the second risk factors. Walking 20 minutes a day and not smoking and losing the extra body fat, that helps to reduce the blood pressure and decreases the risk of high blood pressure, heart attack, and a stroke. Treating high cholesterol, that's very also important. Diabetes, that's number one cause of non-related hypertension, cause of a stroke. Controlling the sugar, treating by medications is extremely important. And now we have new genetic testing that can determine what medication is best to treat heart disease, high blood pressure, high cholesterol, and we can actually target and make the right medication and right treatment for the person and the patient.
So you're talking basically about the specialized individual care that people can now get for heart disease. Now, how big does family history play a factor in heart disease?
Family history is extremely important. The reason for that is we are what we eat and we are what our DNA dictates us to be. Our gene comes in from our parents, mom and dad. So 50% of our genes are from the mother side and 50% are from father side. We know there is a direct relationship between cardiac and heart disease in early onset and genetic predisposition. There are specific genes that can cause heart disease and heart attack, and these genes can be evaluated, treated, and come up with a specific treatment plan that is unique to the person based on their DNA and genetic makeup.
What would you say for people who are afraid of heart screenings?
Heart screening is very easy. It's non-invasive. There is no blood being taken. We simply check the blood pressure. We ask simple questions. We check the breathing, oxygenation. We check the quick EKG, which is a heart rhythm, and to see the rhythm and any specific EKG abnormalities that might present possible problem with the heart. And there is no specific interventions being done at the site. So there is no blood drawing, there is no needle, there is nothing, and it's completely free to everyone. So it's important for you to take a time to come in and ask right questions and be educated. Our job is not to establish the care or continue the care. Our job is to educate communities and let them know to ask the right questions from their doctors and take the right treatment.
Will you be doing further heart screenings in the community to help out these people?
We try to do few different heart screening and throughout Long Island. So we will be doing it in different communities, and our goal in heart and health has always been education and helping the community. And we're going to continue this process, and hopefully we're going to have enough time to provide this service and these educations to all the patients and all the people in Long Island, New York.